Hello and welcome to the Age Well podcast. So today I want to discuss the topic of stress and the effect it has on health. What is stress, and is there such a thing as good stress? And how does the body physically respond to stress? And what's the difference between acute and temporary stress versus chronic stress? We hear a lot about stress in the health sphere, don't we, in the health world. Lots of people are talking about things like nervous system regulation, the HPA axis, cortisol levels, adrenal fatigue, and stress in general. So I wanted to break down some of these aspects. Now, some of them are quite scientific, and I maybe will revisit some of the concepts in later episodes because there's quite a lot of detail, quite a lot of things that happen physiologically in the body during exposure to stress. So I thought I'd give a bit of an overview, but try and break down what happens in the body and how the body responds to stress, because what this will do, it will give you an increased sense of awareness about how your body reacts to stress and some of the symptoms you may experience when you are under stress, and some of the things that you might want to think about doing to be able to reduce those more negative effects on health and on your body. So how does the body physically respond to stress, and what is the difference, as I said, between acute and chronic stress? Now, as always, I do have a script in front of me because I've got a lot to talk about today and I do want to stay on track. So I'm quite new to being in front of the camera. I am not somebody who's naturally confident in front of a camera, so I'm sort of learning as I'm going. So as I become more experienced at this, hopefully I will become more streamlined at doing this. So bear with me. But I have got a script here, okay, just to keep me on track. Stress. Stresses are a stimuli, so there can be individual stimulus or there can be collective stimuli, and this can be internal or it can be external stress. And the stimuli or the stresses disrupt the body's ability to maintain homeostasis. Homeostasis is the body's ability to keep everything balanced. So second by second, your body is sensing and checking everything externally and internally to make sure that things are in balance. And there are lots of aspects to this in terms of homeostasis. It's quite interesting if you want to go and have a little look and read about it. So the body is constantly sensing and adjusting things like hormones, chemicals in the body, different physiological responses in the body to adapt to the environment in which we find ourselves. But the subsequent physiological and behavioural changes are the stress response. So how we respond to the stressor can be a physical response, it can also be a behavioural response, it can be an emotional response, or it could be all three. But physiologically, this will involve the nervous system, the endocrine system, which is the system that involves lots of different hormones. So when we talk about hormones, we tend to be more familiar with the sex hormones, so estrogen, progesterone, testosterone. You may be aware of some of the steroid hormones like cortisol, like adrenaline, but there are lots of different hormones that have lots of different functions in the body. Also, stress affects, or the body responds to stress in terms of the immune system. And the immune system is a fascinating system, again, another complex system, but well worth going and having a little read about and introducing yourself around the effects of the immune system. And also the stress or the stimuli of stress can activate different systems and axes within the body. So this is how different parts of the body communicate with each other. And ones that you may have heard of are the sympathetic adrenomedulla axis and the hypothalamic pituitary adrenal or HPA axis. So these are things that you might have heard other sort of health practitioners talking about in the social space. But the fact is that stress affects and the body responds as a whole, okay? So There will be different systems involved, different organs involved, but as we'll soon see, the whole body can be affected by stress, depending on whether that's acute or chronic. And as I said before, this could be in response to an external stimulus or an internal stimulus. For example, trauma, so trauma to the body, so an external stimulus, or invasive surgery, or there could be an illness, an internal process that's causing dis-ease within the body. But prolonged or chronic stress can cause a dysfunctional response, and this can include symptoms and conditions such as depression, anxiety, heart disease, and even cancer. We now are starting to understand the effects of chronic stress, but not all stress is bad. Okay, stress can be enjoyable, it can be stimulating. So thinking about exercise, okay, those of us who enjoy exercise, it can be enjoyable. Exercise does put stress on the body. And we need that stress because that stress will stimulate other hormones that we need, such as cortisol, which I'm going to talk about in a little while, because cortisol is not bad. So we've mislabeled some of the hormones and some aspects of stress as being bad. So not all stress is bad. We need at least some stress to motivate us, to move us into action, to move us more into that active state of the nervous system. Also, we need to put that sort of more healthy stress on the body, for example, in terms of exercise, to increase and maintain our cortisol levels, because cortisol has other roles in the body aside from responding to stress, as we'll see. And for example, me doing this podcast is stressful, but enjoyable. Okay, it's something that I want to do, but it can be quite stressful, talking to a large audience. But, it's enjoyable. So there can be good aspects of stress as well. So there are different categories of stress. So I'm just going to outline some of the different categories of stress and what they mean, so we can have more of an understanding of what stress is. So as I said, acute stress is a short-term with temporary changes, and how the body responds to this are with temporary changes. So such as an increased heart rate, the release of adrenaline. And this would be a temporary response, and we would expect this to start to settle down. And the other part of the nervous system, so we have the sympathetic nervous system, which sometimes is referred to as fight or flight, and we have the parasympathetic part of the nervous system, which is more to do with rest and digest. Okay, so when there is an acute episode of stress, the sympathetic nervous system will kick in. Hopefully it's only temporary, and then the parasympathetic nervous system will come in and help us to recover from that episode of stress. Whereas chronic stress is when the stressor, as I said, persists over an extended period, and this increases the risk of health problems. So there's also episodic acute stress. So these are frequent episodes of acute stress. And this can be, and this is just an example, this could be an individual who has a chaotic and disorganized lifestyle. And this can impair potentially daily functioning, so the ability to be able to function day to day, and can also negatively affect health. Then we have traumatic stress. So this could be something such as a natural disaster. It could be something in relation to violence, which can overwhelm the individual's ability to be able to cope. And it may lead to a condition known as post-traumatic stress disorder, or PTSD. Environmental stress, such as pollution and noise, overcrowding and unsafe living conditions, can also affect physical and mental health. So the environment in which we live, the environment in which we work, can affect us in terms of our health as well. Psychological stress, so this could be from cognitive and emotional factors such as worries and negative thoughts. We're in a really precarious position at the moment, aren't we, globally? There's lots going on, We're often faced on a daily basis with worrying news, uncertainty. It's that sort of instability that feels like at the moment on an almost day-to-day basis. And this has the potential to put us into negative thought loops, and also having that constant sense of worry and uncertainty as well. And I think that's where a lot of us are finding ourselves at the moment, but not just at the moment. If we think back to 2020 with COVID, it's been an almost relentless exposure to worry and stress for at least the last 5 years. And I think we need to recognise that. We need to recognise that as a society and as a community, and how that might be affecting us as individuals, but also how that might be affecting us collectively as well. But this could also be related to work stress, it could be academic, exam stress, or even social comparisons as well, which is also one of those negative aspects of social media that we know is affecting all generations, I would say, but predominantly, more worryingly, the younger generation as well. Physiological stress, so physical stress such as illness, so that can put stress on the body, but can also cause stress mentally and emotionally as well. This could be from injury, sleep deprivation as well causes physiological stress, and even nutritional deficiencies. So the body is not getting the nutrients that it needs to be able to have that sort of process of homeostasis and keep the body in balance. Then it is going to put the body under physiological stress. So this is just to give you an oversight of the different types of stress that people may encounter. And as I said, some may be sort of more common than others. But in terms of stress, and acute stress especially, the body reacts quite quickly, okay? And the way that the body reacts is that it releases a hormone and a neurotransmitter known as adrenaline. So it's commonly known as adrenaline, sometimes referred to as epinephrine, and also norepinephrine, which is sometimes referred to as noradrenaline. So I think most people would probably be more familiar with the term adrenaline. So this is released into the circulation, and this will react and interact with the central nervous system, the muscles, and other organs of the body. So the whole body, more or less, is involved in the response to stress. So what this results in is it results in the contraction of smooth and cardiac muscles. And what this does is it constricts blood flow. So we call this vasoconstriction. So this will increase blood pressure. It will increase the heart rate. It will also, interestingly, increase glucose levels. So if we think about chronic stress and the chronic exposure to stress and the effects that will have on glucose metabolism, glucose levels, and insulin levels, we can maybe start to think about how this might manifest in terms of chronic health conditions, okay? It increases the need for oxygen, so oxygen consumption, so it will have an effect on the respiratory system, so you will maybe notice that you're breathing quicker. And it can also result in temperature changes as well. There's also changes in gut motility. So it will affect how the gut is digesting food. It can result in symptoms such as diarrhea. It can cause symptoms such as constipation. You might feel nauseous as well. It can also change behaviors as well. So it can make you more alert and also increased vigilance as well. So we're thinking about an acute episode of stress. Now, people always use the example, and I've used this example before because I think it's a good one to use, where where we're faced with a dangerous animal. Saber-toothed tiger, I think, is the one that is often used. So if you're faced with a dangerous animal, you're not expecting it, adrenaline is released into the circulation, heart rate goes up, your blood vessels constrict, so the blood is going to the place where it needs to go to, the heart and the brain, your pupils dilate, you're ready, you're alert, and you're ready to run, basically. Okay, so this is why we have some of those physiological changes. And the last thing that the body wants to be doing in that instance is digesting food, okay? So the blood has moved away from the areas that are not required at this moment in time, thank you very much, and it's diverted to the areas that need to make us ready to run into that sort of survival state, so to speak. So if you think about when you feel stressed, And I know I can relate to this as well. You are hypervigilant, aren't you? You sort of almost have that impending sense of something, waiting for something to happen. In addition to adrenaline, there are other hormones that are released from the adrenal cortex. And this is where I'm going to mention cortisol. And cortisol has been named, it's been called the stress hormone. And it's not entirely correct, because cortisol also plays an important part in the sleep-wake cycle known as the circadian rhythm. Cortisol tends to peak at around about 8 o'clock in the morning, and this is the sort of your internal alarm clock. So it lets the body know that it's time to wake up, and this is usually dictated by daylight, so sunrise and sunset. So this is why exposure to daylight can be really good as a foundation of health, because it helps set that circadian rhythm. But cortisol is a steroid hormone that is also released in response to stress. So too low cortisol and too high cortisol can have negative effects on health. In addition to that, the presence of stress hormones, so I've mentioned adrenaline and cortisol, can increase the inflammatory response, so inflammation in the body. Now, we know that stress and inflammation are the most common causes of chronic ill health as we know it today. We can see that in the research and the literature. So stress can cause inflammation. So chronic stress can cause chronic inflammation. This can increase risk factors of cardiovascular disease, so such as atherosclerosis, which is sometimes referred to as furring of the arteries, which is an inflammatory condition. Interestingly as well, so I mentioned glucose levels before. So in the response to stress, it can raise glucose levels through different processes in the body to release stored glucose and fat. So it can also affect fat metabolism, and it can increase some of the less favourable types of cholesterol, such as LDL or low density lipids, and triglycerides. Okay, I will do a completely separate episode on cholesterol, because cholesterol is another area I think that isn't fully understood, and all cholesterol is not bad, but increased inflammation, increased stress can raise some of the more harmful types of cholesterol. Also, I was talking about menopause last week. So because stress affects glucose and fat metabolism, there is a tendency for women in perimenopause and menopause to put weight on across the abdomen area. So this can be related to chronic stress as well. And this is something I often observe, and I've experienced it as well. This is what can happen. So there can be an adaptation to fat metabolism. As I said earlier, stress hormones can also affect the digestive process, and it can cause altered bowel habits such as diarrhea or constipation. So this is where we can see people maybe developing conditions such as irritable bowel syndrome, where your tummy feels a wee bit upset. So you might have a bit of diarrhea, or you may be constipated. And it can also inhibit the uptake of essential nutrients. So it can prohibit or inhibit the body to be able to reuptake nutrients from food. So it absolutely does affect the gut as well. Last week I discussed the musculoskeletal system in terms of health in the context of menopause. So in relation to stress, the MSK system is affected by loss of muscle mass. So reduced muscle mass, loss of bone density, tension headaches, jaw tension, and delayed recovery from injury. So if you're noticing that and usually in my experience, and everybody's different in their response to stress, but mine tends to start with tension in the shoulders. So usually along the trapezius, the jaw, I start to notice tension, and that's my signal that I may be feeling a little bit stressed. And why am I feeling stressed if it's not wholly obvious at the time? There's also an increased risk of conditions and disorders such as fibromyalgia and back pain as well. So you can see that the whole body is affected and can be affected in response to stress. It's useful, and I have done this in the past as well, when I've been under a period of stress. I started to note down symptoms that I was having. And I did this retrospectively when I had a really difficult period of stress that affected my health. And it was really interesting. As I've said in a previous episode, symptoms are the body's way of communicating with you to tell you that something's not right. And if we choose to ignore or suppress those symptoms, they will just get louder. Okay. So I've always attributed illness with stress. Every time I'm under stress, my immune system is affected, and I usually end up with colds, flus, viruses. More commonly, I have cold sore outbreaks as well. And that's when I know I can guarantee if I've experienced something stressful, no matter what it is, within a couple of days, I'll have a tingling and I'll have a cold sore outbreak. And this is because the stress causes immune suppression. Interesting. So the sympathetic nervous system is activated with stress, and this suppresses the body's immune response. There are sort of two different aspects of how the body responds with the immune system, but essentially it will suppress that immune response. And as I said, chronic stress can increase systemic inflammation, and this can also contribute to autoimmune disease. So autoimmune disease, so diabetes is an autoimmune disease, multiple sclerosis, Crohn's disease. There are hundreds of autoimmune diseases, and we are discovering more as time goes on. So autoimmune disease is when the body's immune system attacks itself, so it can't differentiate between self and non-self. So it's interesting to note that stress can increase inflammation, which can also increase the risk of developing autoimmune disease. Also, stress can affect the reproductive system. So it can affect ovarian and testosterone function. And we know this when people are experiencing challenges in becoming pregnant, for example. Often they're advised to reduce their exposure to stress. Or you'll find that, couples who are trying to get pregnant, can be a stressful experience in itself, they'll maybe decide to stop trying and take a break, and lo and behold, they get pregnant because that stress is lessened or removed. So stress can actually affect reproductive function. And again, this is because the body prioritizes its resources. If the body doesn't feel safe, it's not going to prioritize having a baby. Okay, it's not going to prioritize digesting food. It's going to draw and move resources where they are most needed. So we can see how the body responds to and is affected by stress, and the different categories of stress, different types of stress that people may encounter as well. But it's really important to note that we cannot avoid, nor should we advise that stress should be avoided. I mean, that is just not helpful advice, is it? It would be impossible because every individual experiences some level of stress at varying levels at some stage in their life. Some people experience stress on a daily basis because of the varying factors that I've already discussed. But how we respond to stress in some instances could be considered here. Obviously, we will find it difficult to control our reaction in an acute situation, such as an accident or a trauma or a bereavement as well. But consider how you respond, for example, to a confrontation. So, just things for you to reflect on individually. How do you respond to or react to an impending deadline at work or an unreasonable request from a relative? How do you respond to a delay in traffic when you need to get to an appointment, for example? How do you respond to a text or a social media post? Situational and self-awareness is key here because we can't control how others may act or react, but we do have some control on how we react. So, for example, you're in a meeting and a colleague reacts to something that you've said. Maybe it's a misunderstanding or a misinterpretation of what you've said. And maybe they become confrontational. So an option here, I mean, you could react in the same way, and obviously that would escalate the situation. Or an option here could be to pause the meeting and take a break. And, with a note to discuss things later on once things have calmed down. So that's just an example that's probably more common, I would say. But the best tool that I have used regularly and incorporated into my daily practice is breathing. So it's something that we do involuntary, and we do have some voluntary control over breathing as well. And we know that stress can affect the way that we breathe due to that increased need for oxygen. If I feel stress, I leave the situation if possible. So if it's possible to leave that situation, then I will. If I can't, and an example I'll give you when in the past I haven't been able to leave a situation is I worked for many years in an accident and emergency department. So obviously if I'm involved with an emergency, I'm not going to be able to leave. But what I can do is I can start to notice my breathing. And I can do this without anybody around me knowing what it is that I'm doing. And I can focus on taking slow, deep breaths. Sounds really simple, and it is. Because if we slow our breathing down, it has an effect on the nervous system. Okay, it's telling the body it's okay, it's safe. Ideally breathing through the nose if you're able to, and you can do this breathing in, inhaling to a count of 4 and exhaling to a count of 6. And this will start to tap into that other side of the nervous system, the parasympathetic nervous system. And it can be a really useful tool to practice. If you practice breathing exercises daily, then it's something that and from my experience, becomes second nature. Okay, it becomes second nature, and I sometimes realize that I'm doing this breathing exercise unconsciously because I've been doing it for so long. Okay, so that's just an example of something that we can do as well. Another important aspect of stress is acknowledging that you are stressed. I'm often surprised to a certain extent because I can understand why, but I'm often surprised how defensive people can be when they're asked if they are experiencing stress or if they are stressed. And I think this is a cultural thing because stress has previously and still is in some cultures and in some parts of society, it can be seen as a sign of weakness, which is ridiculous, isn't it? But real nonetheless. So people can be a little bit defensive if they're asked if they're stressed, but it's important to acknowledge that you're stressed. So notice it and name it so that you can start to process and understand what is actually causing it. So what is the root cause? So when we talk about health and disease, we want to know what is the underlying cause. We need to get to that root to be able to deal with it, don't we? And how individuals respond to stress is subjective. It's individual. And, it can be, there are some commonalities in how people respond to stress. There can be some aspects of gender and culture as well as to how people respond to stress. So, for example, often, not always, women can become outwardly emotional and anxious, whereas some men can become quiet, withdrawn, or angry. So obviously I'm not making a sweeping generalization here, and people can react differently. But it's important to notice, it's important to note this because it's important to notice signs of others' distress. So it's important to be able to be observant of how other people are and if they might be under distress because of stress. And just asking that simple question, are you okay, can be enough sometimes. But due to the nature of how we now live and work, it can be quite challenging to spot the signs of somebody's distress on a Zoom call, for example, or over a text. We can hide much more easily these days. And a change in someone's behaviour can be very subtle. They may just withdraw, they might stop communicating, which can be a warning sign for worsening mental health. Depression, anxiety and distress are common, and suicidal ideation and self-harm are risk factors. and we're talking here in the context of stress. So it's important to be clear and ask the question, do you have suicidal thoughts? So these are some of the mechanisms, some of the tools that we use in mental health first aid, aren't they? So it's important to be observant of other people, and ask the question. It's important to ask the question. But also recognizing your own response to stress is important. And symptoms can present themselves in many different ways, as I've outlined today. So it's noticing those early signs of tension, muscle aches, sleep disturbance. It could be you noticing that you've got a bit of a short temper. It could be tearful. However it may manifest, you need to prioritise addressing the cause. So don't try and ignore or suppress symptoms, otherwise they'll just get louder. So things that you can do, you can speak to a professional, you can confide in a friend, take time out if you're able to, delegate tasks and just pause anything that's not urgent. So as a nurse, I wish somebody had sat me down earlier on at the start of my career and told me this. So I worked in a really stressful environment. I worked in emergency care for almost 20 years. And I dealt with situations that most people would never encounter during the course of their lifetime. But I never understood the effects that it could have on my health, and I learned the hard way. So now I have the knowledge and the experience and the tools that I use daily, and I wanted to share this with you and others. So, tips. Have daily non-negotiables, such as hydration. So keeping adequately hydrated can stop you getting a headache, for example, and it can keep you more focused and you're able to concentrate better. Daylight exposure, good quality nutrition, so the best quality that you can afford. Have a sleep routine. Limit bad news exposure. This is really important. So limit bad news exposure, such as the news itself or doom scrolling. Factor in joy. Every day, have one thing at least that you enjoy and make the time for it. Prioritize it. So if you know that you've got a difficult day ahead, so this could be a challenging meeting or, you could be working in one of those busy, stressful environments. Where can you find time in that day to decompress and recover? So for example, meal prepping for the day so that you're less likely to reach out for that quick convenience food. Carry a water bottle, as long as it's not plastic. Going for a 10-minute walk at lunchtime or taking some of those slow, deep breaths for 5 minutes can be enough just to settle the nervous system. So inhaling for a count of 4, exhaling for a count of 6, okay? So yeah, yoga is great, but it isn't for everybody. Mindfulness is good if you understand what it is and how to practice. Meditation is brilliant, and it does not involve sitting cross-legged and trying to empty your mind. But they each have to be practiced regularly so that it almost becomes second nature. So consider trying different things, different tools, and see what suits you. So what I have done over the last at least 20 years is I've built myself a little virtual tool belt. So I see all the skills and knowledge that I've acquired over the last 50 years as a tool belt. And there are different tools that I will use depending on the situation. Okay, so that might be, rolling out my yoga mat and practicing yoga for X amount of time, or it could be, as I said, taking a couple of deep breaths or listening to some nice music, going for a walk. So just trying different things that suit you, that you can practice regularly and consistently so that they become second nature. Do try and make sure that they are realistic, okay, sustainable, and achievable as well. What things do you have in your environment, in your community? Just try different things and see what suits you. So that is the end of my conversation about stress. Let me know how you get on, and please really do enjoy the rest of your day, the rest of your week, and I will see you soon for the next episode. But bye bye for now and take care.